Okay, so first I'm going to wash my hands. So I'm going to do the palms, interlacing the fingers, the dorsum of the hands, each individual finger, and the tips of each finger, the thumbs, the tip of the thumbs, and the wrist. Okay. Hello, DePay Charles.
Hello.
How are you today?
I'm good.
Can you verify your first and last name for me, please?
Yes. First name DePay, last name Charles.
And your birthday?
July 19th, 1996.
Okay, awesome. Let me check your wristbands. Okay, awesome. So my name is Valesky Canal. I'm from the University of St. Augustine. I'm an occupational therapy student there. So today I'm here to conduct different transfers with you. We'll be going through 4 different transfers. At the beginning of each transfer, I'm going to explain to you which one we'll be doing and I'll guide you through it. Okay? So the benefits of transfers is to make sure that you don't have any you don't get any skin irritations or you don't hurt your skin, and also that you do not develop any bone contractors or bone spurs. And also the transfer is going to help you because we're getting ready. It's going to help you get ready for when you go back home to be able to move from one spot to another, okay? So some of the risks that you may experience while we do this, it might just be you feeling a little bit dizzy, and it might be a little bit of a loss of balance, okay? If at any point during this you feel uncomfortable or you feel pain or anything you're not comfortable with, just feel free to let me know, okay?
Okay.
Is there anything that may prevent me from performing these transfers with you today?
No.
Okay. Do I have permission to continue?
Yes.
Okay, awesome. So the first transfer that we're going to be doing is the standing assisted pivot transfer. So the first thing I must do is make sure that the wheelchair is at a 90-degree angle compared to the bed, and that it is also touching the bed, okay? So the next thing I'm going to do after that is I'm going to put the gait belt on my patient. So please point to your belly button. Okay, great. Now I'm going to put this around the patient, so slightly lean forward. I'm going around you. And I'm placing the gait belt below my patient's belly button. Okay, you may release your belly button. And I'm going to tuck this in at the side. Okay. Now I'm going to block this knee for my patient. First, bring this leg forward and this leg back. So my patient is in AP stance. Now I'm going to block the knee. And I'm going to hold you at the gait belt. And we're going to scoot forward together on the count of 3. So 1, 2, 3, scoop. 1, 2, 3, scoop. One more time. 1, 2, 3, and scoop. Okay, great. Next thing we're going to be doing is we're going to stand up and pivot to the bed and have a seat, okay? So on the count of 3, we're going to stand together. 1, 2, 3, and stand. If you need to, you may rest your hands on my shoulders. And we're going to move the left leg and the right leg and the left leg and the right leg. Are you able to feel the bed with your knees right now?
Yes.
Okay, so please place one hand down on the bed. And as we slowly bend towards the seat to sit down, we're going to place the other hand as well. Okay, awesome. Now I'm going to lower down the bed, and hand you your call light. Are you comfortable?
Yes.
Do you have any questions?
No.
Okay. This next transfer is going to be the standing dependent pivot transfer. So the first thing I'm going to do, what is the first thing I'm going to do? Wheelchair name. Okay. This next transfer is going to be the standing dependent pivot transfer. So we're going to make sure that the wheelchair is at a 90-degree angle towards the bed, which it is, and that it is touching. And the next thing I'm going to do is place the gait belt. So I'm going to come around you. Please point to your belly button. Good. And lean forward slightly. Oh, it's fine. Okay, we're putting on the gait belt on the patient. Okay, you may release. And I'm going to tuck it in to the side. Okay, the next thing I'm going to do is I'm going to lock the brakes and remove the leg rest. And now I'm going to ask my patient, can you please put your arms on the armrest? Okay, good. What we're going to do is we're going to scoot forward, okay? Also, I'm going to have my legs around the patient, my feet around the patient's feet to support them. I'm going to hold on to the gait belt. On the count of 3, we're going to scoot forward. So 1, 2, 3, and scoot. 1, 2, 3, scoot. Okay, perfect. So now what we're going to do on the count of 3, we're going to stand up and we're going to pivot and sit on the chair, okay? So on the count of 3, so 1, 2, 3, and stand. And we're going to turn and slowly have a seat, and you can always grab onto the seat for comfort. Okay. We're going to bring this down to make sure the patient's feet is touching the ground. And here's your call light. Are you comfortable?
Yes.
Do you have any questions?
No.
Okay. This transfer is the one person fully dependent transfer. So first I'm going to put the gait belt around my patient. So just lean slightly forward. I'm going to put this around you. Point to your belly button, please. Okay. We're going to put this below the patient's belly button and tighten it. Then I'm going to tuck it in at the side. Okay, so sticking my hand through, not too tight. So what we're going to do next is I'm going to lock the brakes and remove the leg rest and sanitize my hands. So now what I'm going to need you to do is to place your hands on your legs. Okay, good. And I'm going to help you scoot forward, okay? So first I need you to lean this way and have your head going that way. Awesome. And I'm going to pull you forward by pulling underneath your buttocks. Is that okay? All right. So on the count of 3, we're going to move up. 1, 2, 3. Perfect. Now let's lean the other way. 1, 2, 3. Again. 1, 2, 3. Good job. And other side. 1, 2, 3. Good. Okay. So now the next thing I'm going to do is we're going to help you stand up and pivot onto the bed, okay? So I'm going to grab you by the gait belt on the side. You keep looking that way, and I'll look the other way. And we're going to stand on the count of 3. 1, 2, and 3. And we're going to pivot and have a seat. Good. So now I'm going to lower the bed until your feet are touching the ground. Here's your call light. Are you comfortable?
Yes.
Do you have any questions?
No.
Okay. This next transfer is called the sliding board transfer. So the first thing I'm going to do is put this around your waist. So just lean slightly forward for me. Perfect. And point to your belly button. I'm going to put this gait belt below my client's belly button. Make sure that it is snug, but not too tight. Okay? You can release your hands. I'm tucking this end through the sides now. Okay, great. So I'm going to make sure it's pretty comfortable. Now I want you to put your hands at the armrest. And I'm going to hold you at the gait belt and help you scoot forward, okay? So, and let me put my legs around you so I can help support you. And we're going to do 1, 2, 3, scoot forward. 1, 2, 3, scoot. 1, 2, 3, and scoot. Okay, awesome. So the next thing I'm going to do is remove the armrest that's closer to the bed. And now we're going to use the sliding board. So what I'm going to have you do, we're going to lean this way. And as we lift, we're going to put this sliding board underneath the buttocks. Okay, awesome. So now let's sit up straight. So now I need you to place your hands towards the end of the sliding board, but make sure that you don't have your fingers underneath it because we don't want to crush the fingers when we slide down, okay? So the next thing I'm going to do is I'm going to hold you at the gait belt and we're going to slide slowly, okay, until we get to the bed where we want to go. So holding you here and your head facing that way, my head facing the opposite. On the count of 3, we're going to slide. 1, 2, 3, slide. 1, 2, 3, slide. 1, 2, 3, slide. 1, 2, 3, and slide. Okay, good. So now I'm going to have you lean to the side, and we're going to remove the board, and we're going to sit up tall again. Now I'm going to lower the bed until your feet are on the ground, And here's the call light. Are you comfortable?
Yes.
Do you have any questions?